All right, let's talk about chest drains. Today, we're going to walk through everything you need to know about getting one inserted. We'll turn what sounds like a really complex medical thing into a clear, manageable journey step by step.
So first things first, what is a chest drain? Well, think of it as a small, flexible tube that's carefully placed through your skin. It goes into a very specific spot called the pleural space, which is just the tiny gap between your lung and your chest wall.
And why would you need one? Well, it usually boils down to two main culprits. Either there's unwanted fluid hanging out around your lung, which is called a pleural effusion, or there's trapped air, which is a pneumothorax. Either way, that stuff is putting pressure on your lung, making it hard to breathe, and the drain is there to get it out so your lung can work properly again.
Okay, let's get into what you need to do before you even get to the hospital. A little bit of prep work is absolutely key to making sure everything goes as smoothly and safely as possible. Now, this is a big one. One of the most crucial things to talk about is blood-thinning medication. You have to let the hospital know about these well in advance because they'll almost certainly need to be paused for a bit to minimize any risk of bleeding.
And as you can see, it's not a one-size-fits-all situation. The stop times really vary. We're talking a full 7 days for something like clopidogrel, but for aspirin, it might just be the morning of. Don't worry, your own team will give you the exact instructions for you, but this gives you a really good ballpark idea.
And what about packing? Here's a quick checklist. Plan on staying for up to 5 nights, and it is vital, vital, to bring all your current medications with you. Here's a pro tip though. Leave the jewelry, valuables, and even nail varnish at home. It just gives you one less thing to worry about.
All right, now for the main event, the part you're probably most curious about. We are going to walk through step by step exactly what happens when the drain is actually put in. Knowing what's coming can make the whole thing feel way less intimidating.
First, let's just frame the experience. We are not talking about a long, drawn-out surgery here. The whole insertion procedure itself, it's usually done and dusted in about 30 to 45 minutes. That's it.
The whole process follows 5 really clear steps. First, they'll get you into a comfortable position and hook you up to some monitors just to keep an eye on your vitals. Next up, they use a completely painless ultrasound scan to find the absolute perfect spot for the drain. Then, they clean the area really well and numb it up with a local anesthetic. Now, once that spot is totally numb, and they'll make sure of it, a tiny little cut, a small incision is made. Then, the tube is gently guided into place. You really shouldn't feel any sharp pain at all, maybe just a bit of a pressure or a tugging feeling. The whole team will be right there with you, making sure you're as comfortable as you can be.
Okay, the drain's in. So what's next? Let's dive into the aftercare phase. We'll talk about what to expect, how you can look after the drain, and we'll take a transparent look at the potential risks.
It's totally natural to wonder, hey, can anything go wrong? With any medical procedure? That's a fair question. So let's tackle that head on.
So, the good news is, while nothing is ever 100% risk-free, the potential issues here are really well understood. You'll likely have some pain, but it's usually mild and painkillers take care of it. Infection is pretty uncommon, maybe 1 in 100 people, and more serious things like major bleeding, that's really rare. So the bottom line is this. Inserting a chest drain is considered a very safe procedure. Your medical team does this all the time, and they take every possible precaution to make sure things go smoothly.
And guess what? You get to play a super important role in your own care. There are just a few simple rules to follow. For instance, always keeping the drainage bottle below your waist. That's just using gravity to your advantage. And of course, being careful not to knock it over or swing it around helps keep everything right where it should be.
All right, let's move on to the final stretch of this journey. What happens when the drain has done its job? We'll talk about getting it removed and, the best part, heading home.
You know what? Getting the drain out is so much quicker and simpler than putting it in. It's not a big production. The nurse will just have you take a deep breath and hold it for a second, and while you do that, they'll smoothly pull the tube out. The whole thing literally takes a few seconds.
Aftercare for the removal is a piece of cake. A simple dry dressing goes over the tiny wound, and if you had a stitch holding the drain in place, the nurse at your doctor's office will take it out about a week later. Easy.
So, we've covered a lot of ground, right? From getting ready, to the procedure, to going home. So what's the one big thing you should take away from all of this? Here it is. At the end of the day, a chest drain has one simple goal: to help you feel better, to help you breathe easier. It's a common, safe procedure, and your medical team is there with you, for you, every single step of the way. So never, ever hesitate to ask them questions.